Well, the new maternal health plan has been released by the Hospital and Health System Association of Pennsylvania. The report is recommendations for state hospitals and policymakers when it comes to the advancements of maternal health. And I'm now joined by CEO and President of HAP, Nicole Stallings. Thank you so much for coming on in and joining us today. We appreciate it.
Thank you for having me.
Yes, well, I want to begin with your organization here. For folks who may not know of the organization or what you do, talk a little bit about your mission and the work that you're doing with trying to advance maternal health.
Sure. HAP is the advocacy organization representing Pennsylvania's hospitals. We have 235 members. We are charged with supporting them as they address their community's needs. And our board, recognizing the challenges that we were facing with maternal health and rising complications, directed us to look at ways in which we could not just support our advocacy to policymakers for change, but also support our hospitals and what they were doing to improve maternal health.
Yeah, so and I want to talk about that because when it comes to maternal health, you put out that action plan, which includes that three-pronged approach. And again, it isn't just to hospitals, but to policymakers. Why was it so important that you spoke to hospitals, but you also made it a point to say, policymakers, here's what you need to do as well?
Sure. Our hospitals are committed to improving quality within their four walls consistently, but we wanted to really widen that and look at other opportunities to address some of the challenges and factors that are impacting maternal health. And that's where policymakers come in. And so our recommendations: first, ask hospitals to hold up the mirror and figure out where they can do better, but then what are the policy changes we need to really affect change that's sustainable and meaningful?
Yeah, we'll talk about holding up the mirror. While you were putting this together, you found some concerning trends, I would say, here in Pennsylvania. And I want us to take a look at this full screen right here. You found that there was a 40% increase in severe maternal morbidity over the course of 5 years. You also found that racial disparities in maternal health outcomes are widening, with Black patients being 2.3 times more likely to die from childbirth than white patients. So why is this the case, and what can be done to actually fix this?
Really concerning statistics, not just in Pennsylvania, but nationally. And so we wanted to take a multi-pronged approach. We need to be informed by data, but we also need to look outside of the walls of a hospital. More and more hospitals are examining where there are opportunities to partner and collaborate to address social drivers of health, to address things that impact your health when you are in the hospital, like your diabetes or your hypertension. So this report, we believe, really lays out an action not just for looking within the hospital, but partnering across that full continuum.
Well, yes, and that report also showed trends when it came to care deserts as well. I want you to take a look at some of these. At least 18 rural hospitals closed labor delivery units since 2005. That was a part of the report. So how have you seen this impact patients' care or just affect overall health when it comes to rural communities? Because if they don't have a hospital to get to in their area, that could cause quite a problem.
Absolutely. It's something that we're very concerned about. Our recommendations for policymakers look to address that in terms of how do we grow the workforce, attract people into these vulnerable areas, make sure that we are leveraging the full complement of care providers, be it midwives, doulas, telehealth, and others, to ensure that people have access to high quality care.
So, you know, it's interesting because reading the action plan, I learned that there was a lot of issues that people had, not even necessarily in the hospital, but when they came home, right? So a couple of days, a couple of weeks after. So does that mean that hospitals really need to look at some of their post-op surgery or some of their post-op care and what they're doing in that time for those patients?
It illustrates the need for partnership. So when you are discharging that patient, making sure maybe there's a home visit, there's access to treatment and follow-up care that might be necessary, because to your point, so much of what's impacting health is happening outside of the hospital, but we want to be part of that solution.
How much have you seen the healthcare industry be affected by the fact that there's just shortages in people who are working at hospitals, or people come into work and then they say, you know what, I'm sorry, I can't do this profession, I got to leave, there's too much stress. How much of this is revolving around shortages also in hospitals?
Workforce shortages are a critical problem across the Commonwealth, certainly true for maternal health workforce as well. We need to look at ways to attract people into those fields and then to vulnerable areas. We also need to look at reimbursement to make sure that we can keep labor and delivery units open.
So I could imagine anybody anybody who is about to go through this birthing process, it's already nerve-wracking in of itself. And so then when you hear all of this stuff in the action plan, it's even more nerve-wracking, and you just want to make sure that you're in the best position. So anybody out there who is about to go through this process or who may be going through this process again, what would your recommendation or advice be to them to be well prepared in whatever they can do before they go into the hospital? Do you suggest doulas? Do you suggest those sort of things, or is it all really individual for that sort of person?
We believe in meeting patients where they are and what their desires are, be it doulas, be it deliveries at home, which we know are on the rise. I think the message I would say is we know that quality, equitable care is vital to women, to babies, to families, and to communities, and hospitals are going to be a partner in that.
And so what is the next step here? So this action plan has been released. We know that there are recommendations for hospitals and the healthcare industries, but also policymakers. But where does this go from here?
We will be briefing legislators working in Harrisburg to advance a policy agenda, but then also working with our hospitals, bringing them together to share best practices, share data. This is going to be a multi-year effort for us.
Nicole Stallings from HAP, thank you so much for joining us.
Thank
we really
you.
appreciate it. Thank you.